Right, so good morning, good afternoon, good evening from wherever you're joining us from. I'd like to welcome everyone back on behalf of the Boost community and the World Health Organization to the 7th session of the COVID-19 Recovery for Immunization Programs Fellowship, which will cover advocacy and financing within your own government. Next slide. Before I get started, I wanted to go over some logistics for today's session. First, if you'd like to listen to the session in French, please select the interpretation button in the meeting controls at the bottom of your screen. You should see a globe icon. We've also included step-by-step instructions on the screen on how to access interpretation either through your computer or mobile device. Next slide. So during the session, you can engage in dialogue with your peers and session facilitators through the chat box. We ask that you also use this forum to ask any questions throughout the live session. Once we get to the question and answer section, you might raise your hand to voice over your question, that is if time permits. And then last but not least, please remember to rename yourself. So your first name, family name, and then country, so that we can record your attendance for today's session. Next slide. So today I'm joined by our session facilitators, Joanna Feynman, who's the technical officer, and Natalie Van Mel, who's a health economist, who's both of whom are from WHO's Policy and Strategy Unit, working on the Global Access Agenda, as well as Rajama Kumar, who's the head of Health Systems Planning, Management, and Performance at Gavi. Next slide. So for today's session, we'll review the strategic proposal template, including addressing some of your questions around the submission process, reflect on some key takeaways from session 6, and then we'll dive into the main topic for today's session, which is advocacy and financing within your own government. At the end of the session, again, we'll save some time for Q&A with the audience, so I do encourage you to share your questions in the chat throughout the presentation. So a couple reminders around the strategic proposal and case study that you are going to be preparing. Those resources are available in the Boost Learning group, so we do ask that you please download a copy to your draft your proposal. And again, we'll be sharing the links in the chat box. If you could follow the instructions and questions in the template to complete your strategic proposal and case study by the deadline, which is July 1st. And we will be sharing more instructions on how to submit your proposal next week when the submission portal is available. Again, you'll be using the draft document that you've been working on, and you'll be transferring those answers over into the submission portal, where your proposals will be reviewed by our mentors and experts. And then your proposal and case study should focus on activities relating to improving your immunization program, so COVID-19 recovery. And activities should particularly focus on aspects and areas within immunization that suffered most during the COVID-19 pandemic. We ask that you refer to your country's specific data and relevant documents in your proposals, particularly to justify your choice of activities. Again, there were a number of questions that came through last week. We did compile a Q&A of proposal submissions, and we've shared out those links. And again, we'll be sharing them after the session as well. So we do encourage you to read through those questions and answers before submitting additional questions to us. Next slide. And again, just a link to the Learning Group Resource Library, which we'll be sharing in the chat soon. Next slide. And then just a quick reflection on last week's forum question, which was what from the presentation will help you overcome barriers to writing? Next slide. Did something a little bit different this week, actually compiled your answers via a word cloud. I'd say the number one answer was time management was a key takeaway from last week's presentation, as well as having a structure to be able to formulate your scientific writing or proposal. Next slide. And with that, I'm going to hand things over to Laura.
Samir's going to take this. So Samir, are you able to unmute?
Samir, just give us 1 second, please.
So while we're waiting for Samir, I think it was great to see the responses from everybody and the motivation you felt to write your own results. And I think we really want to enforce and motivate you to really think about how you can document some of the lessons that you've learned, because I'm sure many of you have had experiences of how you could improve, or how there are ways to improve your immunization program or other aspects of public health in your country based on some work that you've done. So Samir?
Yeah, I'm here now. So if we can have the next slide, just going over some key takeaways from last week. So as you may recall, we talked about how writing is challenging for all of us, but how important it is to communicate our findings. And as you all know, I try to emphasize that scientific writing is a skill, not a born talent, and therefore anyone can do it. It just requires us to practice, practice, and practice to refine that skill. When we do scientific writing, we use a standardized structure. We went over the IMRAD structure, which includes the introduction, the methods, results, and discussion. And then just as a tip, when you write, to make sure you have linkages between each of those sections, you may want to think backwards. Therefore, when you have your discussion, you want to think about what your main findings are, and make sure going backwards that your results actually present those findings. And then going backwards to the methods, make sure that there's the relevant methods are there to explain those results. And then going backwards from there, make sure that your methods are based on objectives that you talk about in your introduction as well. So those are just some of the key takeaways. Thanks.
Okay, so with that, I think I'm going to pass over to Joanna to begin this. Joanna, do you want me to allow you to share the screen, or will I go through your slides?
Hello, everyone. Hey, Laura. If you can share the screen, that would be great.
Great. Okay, thanks.
I think we have a hand up before we get started.
That's okay. You can continue.
Okay. So hi, everyone. My name is Joanna Feeman, and I'm part of the IVB department on immunization at WHO HQ, working with Laura, Samir, and colleagues. I'm the focal point for the new national immunization strategy, which is the new name for the multi-year plan that you are most familiar with, the CMYP that had been in place for many years. So we've released the new guidance on the NIS, National Immunization Strategy, in August last year. And as you can see from this slide, I want to give a little bit of context for the discussion that we have today, and to really put the NIS as a key pillar to the successful implementation of the immunization agenda and the priorities that we have for the coming years as part of IA 2030. And you can see here the importance of operational planning as part of this strategy. You have the link to the guidance here. There is also a contact email, so if you have any questions, you can, of course, reach out. And I think if we go to the next slide, I want to highlight the key features of the NIS, which really aims to bring a directional change from the CMYP, building on the lessons learned from these country multi-year plans that you've all been involved with, I'm sure, at some point, and really to go towards more strategic planning. And for this, I want to highlight these 5 points that you have on the slide. First, as I mentioned, the new guidance is aligned with IA 2030, the regional frameworks, as well as the new strategy that we'll hear about in more details in a minute from Gavi, and really to emphasize the ownership of this process and the actual strategy. As you can see, what we really promote through the guidance is a document that is owned by the country, that is built on dialogue and engagement of different stakeholders in the country to really build a clear ownership within the country. It's also meant to be strategic and streamlined. So, a short 20-30 pages document, high level, strategic, that really includes a streamlined costing approach and that supports the budget dialogue and the financing. It's meant to be integrated into national health sector planning and as much as possible involve a broader scope of stakeholders in the consultation process. And then finally, and for the purpose of our discussion today, it's really meant to be realistic and to build on the negotiation process with the Ministry of Health, with the Ministry of Finance, with partners, to lead to an agreed and realistic plan with a set of activities and priorities that can effectively be implemented. So if we go to the next slide, you will find an overview of the 7-step process, including in the guidance for the development of the NIS, starting with identifying the relevant team and stakeholders to involve, as well as the documentation, build a situation analysis to identify any gaps, any needs in terms of data, and to really build into the development of the strategy, including a vision and objectives for the coming 5 years. And related activities to be able to achieve those objectives. Linked to the strategy is, of course, a monitoring and evaluation framework, as well as an estimation of the resource requirements that is done through an application that was developed by colleagues from UNICEF, NIS.cost, that allows to have visuals as well on the resource needs per categories, etc. And all of this is really meant to build a dialogue on budget, on resources with the government and with external health partners. Another way to look at this process on the next slide is really to show that from the strategy development to the budget dialogue, it's really meant to be an iterative process so that the engagement in the budget dialogue starts as early as possible and feeds into the strategy development, so that, again, the priorities and the activities that are identified are implementable because resources are available. And as I mentioned, this whole strategy and budget dialogue is very much owned by the country. And again, you'll see towards the later in the presentation that those goals and objectives and outcomes will also feed into all of the Gavi application process, and particularly on the theory of change. Now, if we go to the next slide, I want to launch the discussion on advocacy and financing by providing a bit more detail on this step related to the budget dialogue. And really the NIS guidance provides a few tips on what to do, particularly for this step, and my colleague Natalie will give more details, but really some thoughts on how to defend a budget during a dialogue process, how to develop the arguments on the value of the investments, how to update the resources estimates as needed based on the feedback that is heard, and how the advocacy efforts, including potentially identifying other sources of finance for immunization, can fit into this dialogue, and engaging a broader range of stakeholders across the Ministry of Health, the Ministry of Finance, partners, as well as the provincial finance officers when needed, and really highlighting the importance to have a preparation and clear approach to this budget dialogue to be able to defend that budget and advocate for relevant and adequate resourcing for immunization programs. So on this note, I will stop and hand over to Natalie to go a bit more details in more details in this question of financing. Thank you.
Thank you, Joanna. And hello to everyone.
Natalie, do you want me to stop sharing or do you want me to continue?
I think let's continue otherwise.
Okay, great.
Yeah,
thanks, Natalie.
If that's okay. Thank you, Laura. So Hello to everyone. I'm here to speak with you about the budget advocacy, especially for domestic financing. But before we go into budget advocacy, I wanted to recap which were the three sources of funding that you can tap into, let's say, and reminding ourselves of what does that mean? What are the repercussions of each of these sources? So we have three sources: public, i.e. the government; private; and then donor funding. The government funding is really meant to be more equitable and more universal. So towards the objective of universal healthcare, it is quite relevant to recommend that for public goods and for other health services to be accessible for everyone, that the government helps pay for most of these services. And that is because as a domestic public source, the government is able to mobilize resources, ideally in an equitable fashion, meaning the richer you are, the more you contribute; the poorer you are, the less you contribute. And also to then redistribute and reallocate the resources mobilized throughout the population in an equitable manner. The issue with domestic resources is, as we know, it's quite scarce. And we are therefore in competition with other sector, Ministry of Education, Ministry of Defense, infrastructure development, etc. And even within the health sector, we are in competition with our colleagues mobilizing and needing resources for, let's say, non-communicable diseases, or even building hospitals, etc. So domestic public is a good source of funding towards universal health coverage, but it is stretched as a source of funding. In opposition to public funding is the private funding. We could choose to say, well, immunization expenditures or getting vaccinated is not a very big expense. So why don't we ask households to pay for vaccination? The issue that we can easily identify with this option is that households, only those that have the resources, would then choose to pay to get vaccinated. And we obviously are very likely not to attain the coverage level that we would want to have. And also, when we look at health expenditures, we are interested in monitoring how much health spending is a cause for impoverishment of some households, who, when they go and seek care and have to pay for care, then they really lose some of their revenue and fall into poverty. So this is why, obviously, household spending is not the right source of funding that we would want to look for. And then the third source, as you know, is external funding or aid. That's a very important source of resources, especially for countries with more constrained resources. What we need to pay attention with external funding is that we need to make sure that we allocate the right amount of time to go through the process of applying for the resources. And we also know that when we fund our program or our services or health sector with donor money, that it doesn't necessarily strictly align with our priorities, with the government priorities. And in that sense, we have a plan, and then we have donor funding that creates parallel funding that supports our plan, but doesn't necessarily immediately align and pull funds together. And so we just need to manage these different flows of funds, and it just requires a bit more work. But obviously, external funding is a very important source of funding. So if we go to the next slide, and you will see today, I'll focus on domestic public. So the next slide is a poll question. I want to start with you because I'll remain quite macro. So I want to engage with you as much as possible. And my question now is, how much do you think governments contribute to immunization expenditure in Gavi countries? So what is the share of the immunization expenditure that is paid by governments? Less than 10%, between 10 and a quarter and a half, or more than 0.5%. And this is Gavi countries. So of course it includes low income and low middle income countries. And yes, you're doing well. I think 100% answered. Very good. Yes, not bad. That's very good. So if we go to the next slide, maybe I can end the poll. Yeah. Thank you. So here is the answer. So in low-income countries, in Gavi low-income countries, a quarter of my immunization program is paid by the government. It means for the rest, I rely on external funding, Gavi mostly, and then some other bilateral funders or maybe the World Bank that can support my program. If I am a low middle income country, on average, it's about half of my immunization program that is paid by the government. But if you look at the graph on the right and the orange spread, we can see that the Gavi low middle income countries, the proportion that is paid by government really stretches from as low as 10% covered by government to as high as 80%. And this is because within that group of countries, within the Gavi low middle income countries, you have some countries that are preparing to transition out of Gavi. And then you have some countries that are about to transition out of Gavi. And obviously countries that are about to transition out need to almost fully pay for all of the immunization expenditure. So this is why it stretches so much. The second interesting information from the graph on the right is the one in gray. These are the upper middle income countries or non-Gavi low middle income countries. There are countries that supposedly don't receive Gavi and probably no other donor funding, especially for immunization. But if you look at this graph again, the majority says, oh, well, 90% is paid by the government. But then we still have some countries that are dropping, right? Where quite a large share is paid by some other person or some other sources than the government. And these could be a mix between private funding. So we know in upper middle income countries, for example, new vaccines such as HPV are available and affordable, but only if you pay as a household. It's not covered by the government. Or some countries are, even if they're upper middle income countries, they are in a fiscal difficulty with high debt levels. And in that case, they are relying still on aid funding, which is an issue in terms of sustainability of your program. So if you click once on this graph, I also wanted to raise the issue. Thank you. If you look at the table in the middle, the blue boxes are reflecting what's on the right. So basically, low-income countries, a quarter is paid by the government. High-income countries, 99% paid by the government. But what's interesting is if I'm a low-income country, I know that my immunization program is paid a quarter by the government, but that quarter represents more than 3% of the Ministry of Health budget. While in high-income country, 100% is paid by the government, but that funding represents 0.4% of the Ministries of Health budgets. So when I go and ask for funding from the government, it's important that I understand my immunization program mostly relies on government or on donor funding, because then it helps me understand whom I should ask. And then also, how much is the immunization expenditure representing? How much is already allocated? Because if I go to the Ministry of Health and say, please give me more, and I'm not aware that it already represents an important share of the budget, then I come uninformed. And this is what I'm trying to show with these presentations, is to give information and to encourage you to be as informed as possible. Another, and we will give you a reference sheet with the different dashboards that you can consult, but it's also interesting to look for your country. Is my Ministry of Health allocating as much as my neighboring countries to immunization, or more or less? So if you go to the next slide, today I want to cover 4 points. 4 elements that are important for successfully negotiating your budget. And these are: 1, you need to know how much resources are available. If you go and ask for 3 million, but only 1 million is available, you're not going to get your budget. And this is what Joanna was referring to, the idea of costing and understanding what is available so that you have a realistic budget, not just a budget that reflects what we want to do, but a budget that reflects what we can do. And second, you want to do a costing of your plans. So I'm sure many of you have done costings of plans already, but not everyone. And so I'm just reviewing what are the costing items that we want to plan, to look at and to prepare, and how to go about costing a plan or a project. And then finally, the 3 and the 4 are that you want to demonstrate why the investment is worthwhile. So what will be the impacts of my projects? And here we don't mean impact as an output, no? It's not give me 100,000 and I'll vaccinate, I don't know, 50,000 children. Is why is it worth vaccinating? Why is it worth investing the 100,000 in the vaccination rather than elsewhere? We're back to this competition issue. And finally, demonstrate that I can manage my resources well, that I spend on time and that I spend well. So if we go to the next slide on how much resources are available, we're starting with a poll question. And if you could answer in the chat. Oh, actually, this is very good. The poll question is like this. Thank you. Thank you, Liz. So here, do you already know whom you're planning on asking for your project? And I see 100%. So between local government, Ministry of Health, and partner, it's about 33% each. It's still moving. Others would be interesting in the chat if you could specify who others are. That would be very important for us to understand. I see Ministry of Health pulls up 44%, 45% Ministry of Health. I'll give you a bit more time. Okay, so I think almost half of you are planning on asking the Ministry of Health. So then I think my presentation will interest you. And we were also asking, do you know how much is available? And that I believe you're answering in the chat. So thank you, Liz, for this. Thank you very much for pulling it up. I think I can stop sharing. And I can't look at the, oh, yes, no, sorry. Do you know how much resources? Half of you know how much resources are available. Okay, very good. That's very interesting. Thank you for answering. So if you go to the next slide, let me show you what we mean by how much resources. So there's, if you're at the Ministry of Health, there's a document that you want to put your hand on, which is the medium-term expenditure framework, or the MTEF. This is a document that is prepared by the Ministry of Finance, and the Ministry of Finance says, over the next 3 years, this is how much I expect to receive as revenue. This is how much I plan on spending, and this is where I'm going to spend based on my priorities. So it gives me an idea of the envelope that the Ministry of Health will receive over the next 3 years. So it helps me understand how much I have. And if we go to the next slide, understanding the MTEF is basically understanding what is my fiscal space. So here I'm inviting you to try and have this background information on what is this fiscal space, especially if I go to the Ministry of Health, and knowing the Ministry of Health will need to go to the Ministry of Finance. It's important to understand what is the environment? What is the economic environment? Is my GDP growing? And therefore I can anticipate that my government spending will grow. Is health being prioritized, or is the prioritization of health increasing or decreasing? This means how much is the Ministry of Health, how much is the Ministry of Finance allocating to health? 6%, 10% of its budget, more or less. And it's interesting to compare with neighboring countries, because that really means how much is the government committing to the health sector? Am I going to receive external aid or earmarked funding? And it's interesting to understand what is the execution rate. Some countries have execution rate of less than 85%. It means that the government spends less than 85% of its budget, sometimes 60%. That's what we call the execution rate. That's not very good. So we in a way, the government has resources, it's just not spending it. Why? That could be a whole, we can do a whole seminar on this. Are there earmarked funding? And then lastly, it's interesting to understand also how much is the interest on debt? What is the debt level? In some countries, we see that the Ministry of Finance spends as much on interest on debt as they spend on the health sector. You can spend 6% on health and 6% paying interest on your debts. That is a piece of information that you need to know when you go and negotiate with the Minister of Health or the Finance, because you know how much constraint the person you're asking money from has. So if we go, this little graph is making reference to a World Bank colleague, Ajit Tandon, who did some work on this fiscal space for health. So I encourage you to read more. If we go to the next slide, here, at a macro level, but you need to think for yourself as well. At a macro level, and there's an analysis that was done by some of our colleagues from the health system department here that looked at what was the trend, if we all start from the beginning, what was the growth rate of GDP? And that is the green line. So if you can see, GDP is the green line, and except for low-income countries, that green line grows, but it grows slower than government spending on health. So it means that as the GDP grows, government was increasing its health spending faster than the GDP, which is quite encouraging. So if we go to the next slide, which is about the projections by the IMF, we can see some of the regions, forget the 2021, because that's the growth rate is due to the very slow economic of 2020. But if you look at the last two bars, for example, if you look on the right, the yellow boxes, or at the bottom, the blue boxes, in sub-Saharan Africa or in emerging and developing Asia, we can see that the GDP is expected to grow in 22 and even faster in 23. So that means if I'm one of those countries and I should look for my specific country's GDP, I can expect that the government will have enough resources to continue and maybe even increase my budget for health, therefore my budget for immunization. So if we go to the next slide, this is the word cloud question, which we answered earlier, so we can skip this slide. Thank you. So then the second one, I need to know how much resources I have. This is sort of background information, so that when I come and negotiate, I know whom I'm talking to and what is the context of that person. Second is I need to know how to cost my plan. And if we go to the next slide, we can see that the NIS that Joanna mentioned, the National Immunization Strategy, has a recommendation for developing the budget for the NIS. And that is relevant even for your project. It's not just for the NIS. And the first recommendation is try and involve as many stakeholders as possible. Maybe even the person who's likely to fund you or represent those that will fund you. Have a financial expert who can give you all of the information we just talked about before. Try and have others partner in the health sector that you may collaborate with or leverage for your project and your immunization program, so that you develop the plan and you look at the costs and you develop the costs and you look at the cost vis-a-vis the available resources. And also remember that your cost is there, that you will use it to negotiate. So you have your plan, you cost it in a way that seems realistic with what you know is available, but then you're going to need to negotiate. So be ready to adjust your costs, but you adjust your costs and therefore you adjust your plan. And when you do your costs, there are about 5 categories that you can think of. One, which is usually a cost driver, it's usually one of the most expensive cost item, is specific human resources. And this means spending on HR that will be working for immunization program. Then there is expenditures on medical goods or consumables that are specific for your immunization program. Then there are expenditures on goods that you share with other programs, such as vehicles or fuel. Then there might also be some cost for capital investments and the maintenance of capital. And of course, operational costs such as per diems, electricity, water, etc. So on the right, I gave an example of a more detailed budget that was proposed for when your country applies for funding for delivering the COVID-19 vaccine, be it apply for UNICEF funding or Gavi funding or WHO funding. These are the cost categories that are recommended to to fill in when you cost your budget. So I wanted to give you this as an example. And also when you present your budget, try and remember to also present the cost by output. So for example, if you're going to vaccinate a certain amount of children, and then try and present the cost per vaccinated child, because it gives a benchmark for the person allocating and giving you resources. So if you go to the next slide, Laura, now we've looked at, I need to know how much resources I have. I need to cost well my plan. And now I need to, when I negotiate, I need to show what is the expected impact and what are that I can use my budget well. So in terms of demonstrating the impacts, this is really value for money. So I'll go into the next slide, but first I wanted to ask you, have you thought about the impacts of your projects? And this will be, you can plug that in the chat if possible. And I'm thinking about, do you think of the impact of your project in terms of number of children vaccinated? Or do you think of the impact of your project in terms of measles outbreaks, preventing an outbreak, measles outbreak, for example, preventing further expenditures for curative care, maybe preventing households from risking to fall into poverty because of health expenditures. So what is the impact? And is it simply increasing coverage, or is it sort of what is the value that I will get for my money? Why is the investment worth? Because remember, there's competition for these resources. So if we go to the next slide. Thank you, Laura. Here I'm giving you two examples. One is I want to go back to the story of impoverishment, because in the World Health Organization for the universal health coverage, we are concerned about households falling into poverty because of health expenditures. And with COVID-19, we really anticipate that the progress made over recent years may be halted, and progress is made because the government allocates more to health, because the government takes charge of expenditures on health. This is one impact that we definitely want to follow when we look at the impact of health investment in the health sector. Another impact, and here it's not really an impact, but it's showing to you, if you look at the graph on the right, showing to you that some countries spend the same level. So if you look below the 200, the horizontal line, some countries spend the same amount of money per surviving infant, but they don't have the same coverage. As you can see, some countries have 50% or more of children that remain unvaccinated or undervaccinated. And so it is not a simple equation of I'm spending so much, so I will reach this coverage. It depends on your environment. You may come from a country where there's a low density, and then being able to vaccinate each children requires more campaigns, and that's that's more costly. And there might be environments where an environment is more dangerous than another, so then it costs more to go and vaccinate. So it's quite important that you specify the impact for your specific context and what is the need in your context and what will be the impact of the investment made. And if we go to the next slide, and I think that's almost my last one, you need to demonstrate good use of budgets. So if we can go immediately to the last slide, and you need to show that you can spend the money. You're going to receive money, you can spend it on time, you can spend it well. That means you achieve what was planned. Maybe you can even achieve more because you've met colleagues that also need to do campaigns for maternal and child health. And so you join the campaign and then you save money. And if you save money, maybe then you're able to go and check on vaccinating children that tend to not be vaccinated at all. So use your resources efficiently. That's always a good way to get more funding afterwards. You can also show that you're spending your resources in an equitable manner, that you are working towards making sure everybody accesses immunization. And of course, that your investment is sustainable. You may run a campaign now because you need to do catch up. But during that campaign, you will do social mobilization. Social mobilization will have an impact maybe on next year's vaccination. And so next year, when the routine immunization comes back, the investment made this year to create demand and reassure households about vaccinating and why it is worth vaccinating children, then next year, that's all that investment that is made, and that will facilitate the routine immunization in the future. So showing that your investment is sustainable. And I will stop here. I don't know if we have time to look at the chat and the responses. Maybe not. So maybe I'll stop here and I'll hand over to Ranjana Kumar from Gavi. And thank you for listening.
Thank you, Natalie. That's great. And Ranjana, over to you.
Thanks a lot. Thanks a lot to Joanna and Natalie. Very, very useful. You've talked about macro level, connecting the projects to the NIS, National Immunization Strategy, and the costing and budgeting. And probably I'll now take you to a micro level, something which is really related to the project, and share some experience from Gavi on how we have funded similar projects previously. So before that, I see in the participant list a very mixed participation. Some of you may not know Gavi at all, and some of you may be very, very familiar with Gavi. So please bear with me if a couple of the initial slides are a bit of a repetition to you, and I will quickly sort of introduce what Gavi is about. So as you know, Gavi's mission and the current evidence for Gavi's mission is about saving children's lives and protecting people's health by increasing equitable use of vaccines in lower income countries. And you have seen that Natalie previously has presented data on Gavi eligible country, the low income and the low middle income country. Now, current mission in Gavi aligns with the Sustainable Development Goals and the Universal Health Coverage and the Immunization Agenda 2030. And it's all about leaving no one behind with immunization. One of the important things that we have learned over the years is, as you can see in the figures here in the row below, is more than 888 million children have been vaccinated since Gavi inception. More than 15 million future deaths have been prevented through the health system support alone. In the last 5 years, we have dispersed to countries about 1.42 billion, and an external evaluation and a study shows that the return on investment is really high. So it's a really good investment, return on investment. With $1 spent, you save $54 on deaths and disabilities. Next slide, please. Gavi is a unique public-private partnership, and it was established in the year 2000 with our founding members as WHO, UNICEF, World Bank, and the Bill and Melinda Gates Foundation, with the secretariat, what we call the Gavi Alliance, which is only a secretariat of these founding members based in Geneva. Our country-based partners are, as I said, mainly WHO and UNICEF, and increasingly we are diversifying the partnership with civil society organizations, private sector organizations, and our board also consists of bilateral donors, academia, developing country ministries of health, and other independent members. Next slide, please. Now, how does Gavi support countries at a macro level? We have basically 3 funding modalities, and the subsequent 2 slides, probably I'll go more in detail. One is vaccine support. 75% of the Gavi resources are channeled to countries' ministries of health as vaccines, whether it's pentavalent, measles, pneumo, rota, HPV, etc. The other is health system strengthening support, and I'm part of the health system strengthening team. And this is again to help countries deliver those vaccines from the port of entry to a child's or an adolescent's arm, and now increasingly in the pandemic to adults as well. We also have tailored technical support. That means our support to ministries of health in countries through our alliance partners. Next slide, please. Now, Gavi support aims to assist countries advancing national immunization plans, and hence the linkages to Johanna's presentation on national immunization strategy is incredibly important. It is all about improving immunization coverage at the country level in an equitable and a sustainable way. And you will see that in this slide, there are lots of vaccines that we are supporting. And then in the boxes below, you will see our main funding modalities, cash funding modalities, which is the health system support. Then we have launched a new equity accelerator fund, which is around $500 million, only for the strategic period from 2021 to 25, so current period, to reach zero-dose children and missed communities. And the other cash grant is on cold chain equipment optimization platform. And supporting all this is partnership engagement framework, and more about it later. Next slide, please. I won't go into the details, but I want to leave this slide with you for reference later, that it elaborates on several other cash grants which are also available to national immunization program. Next, please. Now I'm coming more and more to your projects and what is expected of the projects. Now, as Johanna and particularly Natalie, you mentioned about access to funding. Now, the entire Gavi funding actually goes to the ministries of health in a country. This year, with our strategic mission about reaching zero-dose children and missed communities, we have launched additional partnerships through the Equity Accelerator Fund to humanitarian partners as well. And increasingly, the Gavi grants from the country level are channeled more and more to subnational level, and particularly communities and local level partnership. Now, any Gavi grant of funding that you would like to apply for has to follow a framework that the Alliance developed, which is called the Irma Framework, which is presented on this slide, which is merely I is for identifying the zero-dose children in missed communities. Who are they? Where are they? Why aren't they coming? Why aren't they accessing the system? And first, and the most important, is how many of them are there. Once you identify them, then countries are expected to develop targeted strategies which are tailored to the country context and are sustainable, which address both supply and demand side constraint. But the implementation of this strategy is through a broader integrated primary healthcare platform, and through the life course. We do not want to see, silos, verticalization of program, because it's really fragments the approach, and probably it's counterproductive, because reaching these communities, it's not only about integrating health program, but we have to go that extra mile to find local partnership in immunization and other areas as well. For example, even we are working with the International Organization for Migration, for example, to reach the nomadic tribes and the internally displaced population or refugees, which are increasingly becoming more and more zero-dose. The other part of the framework is about monitoring and measure. That means really tracking the progress and course correction, learning from the experience and course correction. And last but not the least, use the evidence to make a case to secure political and financial commitment. And when I say financial commitment, I'm going to now elaborate on a couple of examples on how you can access some of this funding. Next slide, please. So this slide, and next slide, please. Thank you. So these are the two programs we have piloted and tested to a fair degree of success in Gavi 4.0 or the previous strategy. The previous slide was on STEP, that is strategic training of executive program for supply chain managers, which was national as well as subnational supply chain managers. And the second on this slide is the expanded program on immunization leadership and management program. So we addressed these through our special program or initiative, which was called Leadership, Management and Coordination. And here there were several interventions, but this particularly is related to your projects or proposed projects. And this is a training program where participants receive training on leadership and management coordination, but through several modules, which was hybrid, face-to-face, as well as remote through mentoring and coaching. They had to choose a capstone project or a breakthrough project. That means that through the period of this funding, which was about 6 to 9 months course, they had to choose a project which was a burning issue related to immunization in their own country, in their own district, in their own county or local area, where they could improve immunization coverage, because that was our focus previously. And I'll just go through one country example for detail on how this was done. Next slide, please. Now, this is a country example of Ghana, and I know there are a couple of participants from Ghana today, so you may relate to this or may not. Now, as part of Ghana, this funding was particularly to a national, subnational team, a team from Ghana which participated in the EpiLam training convened by the Yale University, with in partnership with the University of Global Health Equity in Rwanda. And for Francophone countries, it was with the University of Cameroon. Now, this team of 5 to 7 participants had to choose one project. And you will see Ghana chose the project on improving Penta 3 coverage. Now, the trick to this is the project is successful when you really choose the objective which is very relevant to your current country national immunization plan, or the current support of Gavi, which is a full portfolio planning, or the Gavi application on the Equity Accelerator Fund, which most of the countries are doing. I would like to see, as you have seen in Ghana, that they were very specific about choosing their objective. That means they started narrowing down the objective quite a lot. And they are saying that out of all the regions in Ghana, they prioritize the Volta region. And they said that they would increase the pentavalent vaccine by 10% by end of December 2021. So they took a 2-year period here for implementation. Now, they did a root cause analysis, and root cause analysis going into all the possible reasons on why there was a stagnation or decline in coverage in the Volta region. And you will see these slides, I'm going to let it remain with you. So there were lots of, after brainstorming, lots of regions which included supply chain, logistics, supportive supervision, lack of micro plans, EPI reports, etc., etc. And then they zeroed it down on one particular strategy which was in their own sphere of control. And they choose the strategy with a maximum impact at the country level, at the local level, which was on supportive supervision. Next, please. Next slide, please. I think the slide is stuck, but the next slide is actually a fishbone. Yes, a fishbone diagram of the root cause analysis that Ghana did. And you can see at every step they went on asking the question, oh, but why doesn't it happen? And then one step further, and out of all this, they chose supportive supervision as something that this particular team will choose. Next, please. Now I'm going to rapidly go through, because there's several countries here experience we have got. Now, Kenya used a topic about reducing high dropout rate of MR1 to MR2. Next, please. in a particular county. Malawi choose a topic on data quality and how they will decrease the mismatch of data, immunization registries and tally books. So it was all about data quality in the particular region, southern region. Next, please. Uganda chose a topic again about increasing MR1 coverage by 10% in a particular district. Next, please. Somalia used a topic on improving Penta 3 coverage by 10% in 5 regions with the highest nomadic population by December 2021. Next, please. So you will see each country really chose topics which were contextual and important to their countries. Now, there are certain key success factors if you want to submit your proposal, and these proposals really have to be submitted to your own national governments, because Gavi does not have a facility to support individuals financially, but Gavi is supporting the national governments through the HSS grants and the Equity Accelerator Fund. Now, some tips and tricks for you for a successful project submission to secure financing. One is that please ensure that it links to the national immunization strategy and the country's priorities. Next is that, as Johanna has mentioned in her talk, that the national immunization needs a situation analysis. For your project, you really need to have a local situation analysis of the local context and the root causes. The next is that please choose an intervention which has a highest impact. So prioritize, because fishbone will throw up a lot of issues, but please choose something within your control. The other is that please define the interventions. I think Natalie also mentioned that, and how to get there, define a timeline like all these countries have done, and exactly what you'll be doing. The other, as I mentioned, please address this to your ministries of health, your district health officers, because as you know, all these Gavi applications, they do have annual operational plan at the national level, but every government works differently. In some countries, it's a bottom-up planning where each district have their own plans, but you will know best which is the right place there. There are 2 other ways also to access the funding. One is, as I mentioned, full portfolio planning. And following this talk, I will share with WHO a list of countries which are going for full portfolio planning in 2022 and 2023. This year, about 14 countries are coming. And the second one is the Equity Accelerator Fund I have mentioned. This year and next, we are expecting almost 40 country applications. So please watch out, please reach out to your ministries of health and find out the details. And the other one, where a country is not applying for any of these financing, then we have annually a joint appraisal or a multi-stakeholder review. And again, you'll have to reach out to your own EPI teams to find out when is this happening, because that is a time to review performance and do course corrections. Next slide, please. Probably this is my last slide. Thank you. Thanks a lot. Over to you, Laura.
Many thanks, Vandana. That's great. And I think these key success factors, I think, are really critical to help people think through how they can go about trying to access funding through their own governments. Samir, I'm going to pass over to you briefly.
Thanks, Laura. So we're going to get started on questions, but before we do, I just thought we'd just do a quick summary of the presentations, because normally we don't have 3 different talks in the same session. So I thought it might be helpful to just do a quick summary of what's been presented today. So at the very beginning, Joanna went over a very nice talk going over the national immunization strategy, which is what ideally countries should be having. We previously called it the CMYP, the Comprehensive Multi-Year Plan, and it's now called the National Immunization Strategy. The reason we presented this today is just to remind everyone that every country has a 5-year long-term strategy toward how they want to strengthen their immunization program. So when you come up with project ideas, it'd be, if possible, it would be great to try to be mindful of that and to align with the priorities of the national government, because we want to be working toward the same goals, not working against it. So it's just important to get a background on what the NIS is, National Immunization Strategy, and then try to work in alignment with that. Then Natalie went over the financing issues in the country, and I thought it was an excellent presentation showing us how there are different potential sources of funding for immunization programs, and also, by that same note, different potential funding sources for your projects as well. And she presented as well, and I don't know, Laura, if you can show that slide again, in Natalie's presentation that showed the 4 steps that you should think about in terms of how to present, how to advocate for resources within your government. You need to have an actual plan in place, an actual budget proposal, show value for money. There it is. Know how much resources are available within the government. And Natalie made a point. It's important to know what's the situation in your government in terms of what kind of resources are available. Is it a government that's already fairly strapped for financing and is unable to finance quite a bit of the immunization? Or is it a government that actually is able to finance quite a bit of the immunization program? You should still try to advocate within your government, but you need to be mindful of what type of perspective the government has. You need to know how to cost your plan. So you need to have a budget. You need to be able to advocate that you expect to have a certain type of impact with your project, and then demonstrate good use of your budget. So these are rules of thumb for advocating for an overall immunization program, but it applies to your individual projects as well, to be mindful of these 4 different elements that should be taken into consideration. And then finally, Ranjana's presentation went over Gavi. Again, there are more than one potential source of funding for your projects, but we wanted to have Gavi present here because they're one of the more important donors for immunization programs in most of your countries. And I thought this slide was excellent because it showed, based on the experience that Ranjana had with Gavi in financing similarly projects like what you're going to be advocating for, the lessons learned and the success factors, right? Having a proposal with a strong narrative is important. Linking it to NIS again, addressing your Ministry of Health and District Health Officer and engaging the stakeholders in the process. So therefore you get more government ownership into this as well. And then it's important to know these different windows and leverage financial levers that Gavi offers to countries and how you can potentially access an opportunity to advocate for your project within that as well. So she mentioned the full portfolio planning, which is the 5-year funding cycle for a country for Gavi funding. But if a country is in the middle of that 5-year cycle, there are annual reviews that occur, these annual multi-stakeholder reviews, and that's an opportunity to reassess how the funding is going and for an opportunity for one to potentially advocate for a reallocation for a new project, which is what many of you might be trying to do as well. So that's kind of my overall summary for you. And then what I want to do right now is there were a few excellent questions that came up, and I just want to start sharing with all of you. And I believe the first question goes to you, Joanna. It came up in the mention of going over the national immunization strategy, and you mentioned the theory of change. And we did get one question. Can you brief again, what does the theory of change mean?
Thanks so much, Samir. And it's actually very much related to the Gavi application process. So I think this is the theory of change that Ranjana mentioned in her presentation, highlighting again the linkages between the NIS and the overall strategy and identifying the portion of that strategy that will be or could be supported by Gavi for the Gavi eligible countries, of course. So the theory of change is linked to the Gavi application process. I don't know if you want to add, Ranjana.
Thanks a lot. Thanks a lot, Joanna. Yes, theory of change is an instrument, but as Joanna, you also know that the national immunization strategy, you do the SWOT analysis. Countries do that. In several of the countries, they do the coverage and equity assessments. In these Gavi projects, which I presented, they do fishbone analysis. Basically, these are the instruments to better understand the situation analysis and then identify the right interventions which will give you the results that you're hoping for. So this is theory of change is really the logical approach to identify problems, then the interventions, the outputs and the outcomes. and then what are the risks and assumptions as you go forward. And it's a very logical way of doing it, and that's what we advise for all Gavi funding applications. Thank you.
And if I can chime in, I don't know about everybody in the audience, but I have to admit, I, until a couple of years ago, had never heard the term theory of change. So it's a relatively new term from myself. I've heard of these other alternative approaches, such as Ranjana mentioned, the fishbone analysis, the SWOT analysis, logic models is the term I've heard used before as well. There's an overlap in all of these things, which is that no matter which of these approaches you take, the intention is for you to have a methodical approach to trying to understand what is the problem in your context, what's the real source of the problem, and how are you going to approach addressing that problem. So I think that's the end objective of whatever approach you take. Now, for Gavi specifically, for the national government, when they apply for Gavi funding, they're going to have to do an official theory of change, which is its own, has its own methodology that will be applied there. For your projects, or when you're doing advocacy with the government, it's not that you need to have literally exactly the theory of change with that methodology necessarily. It's more about the idea that you need to be able to justify the rationale behind why you think this specific intervention or this specific project is going to be helpful for the immunization program overall. And you need to show that you've done a little bit of a thoughtful diagnostic process, systematic approach. It could be the fishbone analysis, as Ranjana had talked about, that Ghana had done. It can be a theory of change. It could be a SWOT analysis, but something that shows that you put some rigor into it, some methodological approach, systematic approach to try to identify what the problems are, to justify your intervention. That's the main point, to make sure you went through that process. So if I may move on to the next question. One person had asked how to make private and external funding fit into the government priorities. And I opened that up to any of you because I think all of you touched upon some aspects of this. But maybe we can begin with Natalie, since I think this overlaps a little bit with your mention of having multiple funding sources.
Yes, that's a very good question. Private will be challenging. I don't really see how you can make it fit with government priorities. External funding, by experience, for me, the most efficient way is, to leverage what we call I'm forgetting the word now, but the dialogue with the partners. And typically, WHO, for example, in many countries is the lead partner that calls for these monthly meetings where all partners and the government obviously meet together to discuss the issues, health issues, and how the different funding is helping. And that is the best way, through dialogue, to sort of help have everyone align around the same priorities. I'm forgetting the word now. It comes back. I'll put it in the chat. I'm just blanking. For the private sector, if it's households, I don't see how you can make it fit with government priorities. If it is, it could be private in the sense non-profit NGOs, or also private in the sense of private insurances. And it could be, again, non-profit. I know that the ones that I know best, but I don't know all regions as well. But I know that in some countries they have what they call community-based insurance. So that maybe sometimes by sponsoring them or funding them or providing as subventions and supporting these agencies or institutions, that is a way of having them align with the government priorities. I know Uganda, for example, relies a lot on providers. That's not community-based insurance, but it's providers, NGOs, not-for-profit, or religious-based health providers, and they get funded by the government. So those are the way to engage through engagement. But especially the donor funding, I would say through dialogue and these collaborative platform where partners and governments are working together. Yeah, and depending on how big your country is, some partners are investing in some regions. For example, I know in DRC, there were some regions where the government wasn't providing as much health services. So then partners were sort of picking up on these regions for a while. So that would be that's my input for now. But good question.
Yeah, and I don't know if Joanna and Regina, if you had anything else to add, since this also overlaps with things you had talked about as well.
Yeah, so maybe I can add a very specific and concrete country example. The STEP program that I showed in my slide, we had private sector funding from the UPS Foundation, and then some of the other private sector donors also joined in. So just to build on what Natalie said, each of these private sector fundings also have something called a corporate social responsibility. And usually we see in several of the Gavi eligible countries that these private sector donors, wherever they find a shared goal with the governments, shared goal means shared goal which are similar to the national health plan and what the country wants to achieve, or the national immunization strategy, then they sort of press in and they come forth, or the governments seek that kind of a funding. And we found that a way to channel these funds, secure these funds. Thank you.
Thank you, Ranjana. Let me move on to the next question, which is going to come back to you, Ranjana. But the question is, what is the procedure to apply to Gavi grants? And I know you covered this during the talk, but I think it can be confusing for many people. So it'd be good if you can go over that again. And also go over who's eligible for that.
Thanks a lot. So the latter question I'll take first, eligibility. So only national governments are eligible for Gavi grants. Now, what the Gavi eligible countries are those which are determined by a threshold of gross national income. And but I think in the current period, it's around $1,500 per capita per annum. And any country which is below that is Gavi eligible. And for the current strategic period, there are 57 low-income countries which are Gavi eligible. Now, how to secure Gavi grants? In my slides, I showed you a couple of windows. We call them windows, but which are basically grant opportunities to countries. And these are mainly 75% of Gavi grants go as vaccines, as vaccine commodities, auto-disabled syringes, etc. And supporting the delivery mechanism are several cash grants. A country is expected to prepare a proposal, just the way you will prepare a proposal. A country at the national level is expected to prepare a proposal which goes to the rigor of a theory of change, stakeholder consultation, coming up with interventions. As I showed you the framework, the Irma framework for the current strategic period to reach zero-dose children and missed communities. And once that is ready, you also have to indicate what are the domestic resources. As Natalie pointed out, and in the survey, I saw that almost 50% of the resources you said were coming from domestic resources. So you have to indicate what are the domestic resources you're putting in, what are probably resources from other donors, and then how Gavi will really help you. Once the application is ready, it has to be endorsed by the National Immunization Coordination Committee, and then it is submitted to Gavi. And then the Gavi has a mechanism to approve this proposal, which are usually independent experts. It's called an independent review committee, which are really global and national experts who join this committee. And they sort of recommend approval to the Gavi CEO. And then once that is approved, the funds are released to the countries. Increasingly, we are seeing that resources are going through CSOs through the national government, subnational governments. There is also another window through Gavi. And my last point is really, there is a very small funding window, because I saw the question in the chat about how to fund research. So again, these research grants are given either to the national government in the national proposal submitted to Gavi, or through the partnership engagement framework, where we have a particular research implementation grant where WHO and UNICEF lead on it, working with several country national level institutions. I hope I answered that. Thank you.
Yeah, you did a great job. But let me ask you a follow-up question that might be relevant to some of our participants here. So hypothetically, if I'm a subnational person, subnational immunization officer, and I have a project idea for this fellowship to help improve immunization, catch-up vaccination, or help recover the immunization program. Say I want to engage with the private sector and have a project idea, need a little bit of funding. Can we discuss potentially what are the steps I can take now moving forward to potentially getting this funded through Gavi resources? How do I get this up to the point of where it gets to the national government level so it could be included in the funding that comes from Gavi? You're on mute, Ranjana.
So all the good things I said about you, Samir, they were muted. Anyway, so I said that is a really good question, because Gavi, from a global level, we really, don't think about individual projects. But after all, it's a collective effort of individuals, of subnational entities, of districts and provinces that really help up that bottom-up planning. So I would say for an individual, and as I showed in my slide, it's very important for you to link through your district, probably authorities or whatever your local authorities are, and then see what are those priorities in the district plans that they are making, and then see where are the private sector funders which are there. I'll give you a concrete example. For example, in India, there was a partnership with Unilever in a couple of districts in Uttar Pradesh. And here the partnership was all about washing hands. So safe, safety, security, hygiene, and connecting those messages with immunization. And so that really worked well. Now this again, we did it, not we, the government did it with the partnership of Unilever in some of the districts and subnational entities. So you have to really find out what your local level private sector is and how you can secure those funding. So there was funding from Gavi and for Unilever, which supported the government efforts. Over.
And I'll just share my experience having attended some of these Gavi national meetings, these multi-stakeholder dialogues. Most of the governments invite subnational colleagues to come to these meetings as well. And what I've witnessed and observed is that the subnational level will have specific projects in mind that they advocate for to be included in the plan for funding for Gavi. So they walk into these meetings with a list of projects that they're wishing to get funded. And so my thinking is that they've had these discussions probably at their local level beforehand. So although you at a local level may not know whether the ultimate funding is coming from Gavi or domestic financing, I think the bottom line is it's important to try to align with the government priorities at the local level, and then they have an opportunity to advocate on behalf of that project above you. So I don't think you necessarily need to know at a very localized level whether the funding ultimately comes from Gavi or the national government domestic financing, but you do need to be able to successfully advocate on the importance of that project so that they know to then advocate for it within with the Gavi donors or with their own domestic financing.
That's right. That's right, Samir.
That covers all of the main questions that we had. Let me also ask Laura if there was anything else that you had noted as well that you wanted to ask.
Yeah, no, I think there's quite a lot of questions coming in from people who are wondering how they can access funds, and if it needs to go through government approval to be accepted and whatnot. I think what we've advocated from the very beginning is writing a proposal. It's very important that you get approval from your ministry or whoever you're going to be working with to implement this project, or you hope to implement. But also you have to consider that maybe some things that you're proposing or some ideas, it doesn't require funding. So be aware that you have to try and be think through ways that you can do this potentially without having to think about funds. But I think as part of the strategic proposal, we have put in a certain section where you can have a budget outline and try and think through some certain aspects that would be required. So I think it's very good that you try and think broadly about what is possible, what is not possible. And I think there are many of our governments, particularly our ministries of health, are very, very, very busy with rollout of COVID-19 vaccination. And the aspect related to COVID-19 recovery, I think, is something that we need to bring to more attention, because I think if we don't, we're really going to be seeing large number of outbreaks over the next couple of years. So I think if you can think through a proposal and put that forward to relevant stakeholders and relevant people within the Ministry of Health, I think they will be glad to see that people are thinking about ways in which they can improve coverage. Just Ranjan, I noticed in the chat that there's a couple of people who've asked questions about how funding is tracked, or what is the monitoring mechanism used to look at agreement to maintain certain indicators. So I think it'd be helpful to kind of help people understand how that is done, because I suppose people are coming from different levels within the country health system. So I suppose understanding how is the funding tracked and how is their monitoring done by Gavi to ensure that indicators are met.
Thanks a lot, Laura. So this is really a good question. And usually what Gavi does is that every Gavi grant has a MEL indicator framework, which is monitoring and learning indicator framework. Now, all these funding opportunities that I mentioned, with every country, we have a grant agreement, and that grant agreement specifies the process and the indicators that a country needs to report on. Usually Gavi never duplicates or asks for additional indicators, and we usually rely on the joint reporting form and the country's own HMIS, and which are reported annually by each country, their own administrative data. Our macro level sort of validation mechanism is really, we depend on the WHO, UNICEF, the WUNIC estimates, which are published in July every year. So our impact level coverage indicators are mostly those. And then we depend entirely on the administrative data. We do have a mechanism for sample countries where there is an additional survey done at times, again with other donors, partners, or again, which are jointly advised by the country's own immunization coordination committee to validate some data at some frequency. But usually we depend on the country's own data. Thank you.
Great, thank you so much, Ranjana. Okay, I think we're coming to an end, so I'm going to pass over to Liz to close out the session.
Great, thanks, Laura. And can you just confirm that you can hear me?
Yes, we can hear you.
Okay, great. So thanks again to all of our session facilitators and of course all of our participants for being very engaged in the chat today. So our reflection question for today's session is, what from this presentation will help advocate for finance within your government to implement COVID-19 recovery activities?
Sorry, Liz, you're breaking up. So so maybe I can just say that the reflection question here is, what from this presentation will help you advocate for financing within your government to implement COVID-19 recovery activities, or what follow-up information would you like to have? So that's something for you to consider and think through, and we hope that you will go to the Boost Learning forum and respond to this question. And it'd be great, I suppose, to get your input and feedback, because financing is often an aspect that people at different levels are not made aware of. I suppose some of you were from non-Gavi eligible countries, you've learned about maybe a different form of financing that happens in other countries. So I think consider your own country context and what would be best placed for you to think through that. And then following on from that, Next week, we have our final session, which is going to be on comprehensive session planning. So this is an aspect of immunization that I think a lot of people, really need to focus on, because we'll discuss wastage and how you try and forecast for who will be in a session. And I think it's also going to explain some things related to effective vaccine management. So we look forward to having you there, because we have a great team set up to describe the comprehensive session science planning. So like I said, it's the last session is coming up next week. And as always, make sure to take the post session survey, look at what's happening in the Boost Learning group. You can also follow what's happening on the Fellowship Telegram channel. And like I said, we have the next session coming up next week. So a huge thank you to our presenters, to Joanna, to Natalie, and to Ranjana. I think you got a very broad view of financing that hopefully will give you some aspects of learning related to this area, and maybe help you understand a bit more how funding happens within your country. And don't forget to continue working on your strategic proposal, because they are due on July 1st. And if you have any queries or questions related to that, remember that you should look in the Boost Learning group, because all questions and FAQs are there with some guidance and also the templates. So please make sure to go through those and read and follow the instructions carefully, because all the information is detailed there. So a huge thank you once again to everybody, and look forward to seeing you all next week.